government's decision to scrap the remaining Covid-19 regulations have been widely welcomed. Among the scrap regulations are the use of masks, restrictions on crowds and requirements of Covid-19 tests for international visitors. Higher Health is among those who hailed the government's decision on this. To find out why, I'm now joined by Higher Health's Professor Ramneek Ahluwalia. Professor Ramneek, thanks for speaking to us. Now, according to reports, reported cases have declined, hospitalizations have declined, the effective reproductive rate of the virus has declined to 0.7%. Is this sufficient cause for regulations to be terminated or ended?
Definitely they are. I mean, what science is telling us is, and what we've seen is that we do not have found a variant of concern that has the potential to replace the current variant, which is Omicron, which caused us a fourth wave, or predominantly a little blip that we saw, the fifth wave of its subvariants. And these are good signs for the global world and South Africa for now, as much as we still will be studying COVID-19 in detail, because the virus still remains around us, but it seems to have tamed down. So the severity of the infections and the hospitalization are two big indicators that help us define that we are currently what we call it in a safe zone. And I think the economy or the productivity of the country or the world that needs to move forward can proceed in that direction. And I think that's where the national policy is. However, one warning will always be that which any public health expert will always give is that as much as we know it's COVID-19, we are in winters, but when you are indoor, when you're in crowded, when you're in closed congregations of lots of people, wearing a mask will always help, not only just for COVID, but for many other viruses that are very much prone in winters, as viruses love cold seasons. So this is just a good warning sign, but for now we are safe, in a safe zone.
Okay, so we shouldn't throw away our masks altogether. But let's talk about those with comorbidities. How should they deal with this? Should they feel as free as the next person, or are there certain things that they need to do to safeguard their health?
I think anyone who has comorbidities or anyone who's old, who's vulnerable, not only just COVID, parallelly it goes with monkeypox, which is currently a new virus that's showing outbreak, or whether we're talking about another virus or bacteria, or even influenza. In fact, influenza kills a lot of old people and people with comorbidities. So I think for anyone who's in comorbid, COVID is a wake-up call for all the world in a public health scenario to say that, when you will find yourself in congregations, in indoor, less ventilated, closed, crowded, wearing a mask will always help you, because it is preventing you from getting droplets or airborne diseases quite close to you. So I think people with comorbidities in general need to be looking after themselves more than any other individual, considering that they are more vulnerable of acquiring infections in a severer form and leading to hospitalization. I think COVID-19, like many other viruses, had shown similar affinity to people with comorbidities or people who are older due to their immune system being compromised.
Now, we know that 50% of South Africans have received at least one dose of some form of vaccination. Not quite the 67%. I think it translates to about 30% roughly have been vaccinated. Not quite the 67% that we were hoping for, which is herd immunity. Do you think, though, that even without achieving the 67%, we've achieved a herd immunity of sorts?
We haven't. I think this herd immunity concept is not as prevalent now in a discussion as we used to have it when the early days of COVID came, because we wanted to figure out how do we find an immune system in our human body, because this was a novel virus and humans didn't have immune system to fight such a novel virus. But what has happened is 80% of the global world population, or 80% of South African population, as per the studies, either have already got COVID and even got reinfection. So what's happened is people have now built something called a natural immunity or an acquired immunity, which is an immune system built by acquiring an infection. Now, while that happened is where we really believe that our immune system is holding fort, this virus no longer remains novel, and that is why we are now seeing that the virus is likely to taming down. But the biggest strength at that time was our vaccine immunity, which still remains, because the natural immunity weans down with time, but boosting yourself through a vaccine will be very, very critical, because it can bring your immune system back to its high front, so that, as you already know, COVID causes reinfections. COVID can happen again. And why we know that the needing of timely boosters, timely of getting your vaccine is critical. So the appeal is still, please get vaccinated, because the virus has not moved away from the human mankind. It is still very human to human transmissible. It's just tamed down for now, but because this virus has shown it causes reinfections, it seems to be that our immune system does wean time. With time, vaccine immunity will hold. And I think I really plea and people listening to please continue getting your boosters, or if you've not been vaccinated, to get vaccinated, just to be ready for your body system to be always able to fight COVID-19.
Professor Ahluwalia, the next question is a two-part question, and the first part is we've had 48 months or more of COVID, and we've obviously learnt many key lessons. What are some of those lessons, particularly now when we are faced with the threat of monkeypox, which is now on our shores?
I think the one thing is the environment is changing. The climate change is happening. We're seeing viral mutations faster comparative to what we've seen in our previous lives or previous generations around. And climate change, environment change will bring more and more human challenges around with these microorganisms. We call them viruses, bacteria, things which are invisible to us, and poses a severe threat to human mankind or our human existence. And I think COVID is a brutal reminder, which means it warrants governments and any development to put investments into health well-being, health promotion, appeal to media houses. You've done a fantastic job on health education.
Professor, allow me to come in very quickly, because we will need to move on rapidly. Just your thoughts quickly on monkeypox, how we need to deal with it. Should we panic, or are we okay?
We should not panic for now. We just have very few cases, or just one case is identified. This is an outbreak. This is not pandemic. This is not a respiratory airborne disease. However, it does spread. We've seen this new variant has mutated to develop a faster human-to-human transmission. It spreads through, like, you have a rash, you have a pox, it bursts, it has a fluid, and the fluid to contact will touch. So skin-to-skin contact, sexual transmitted ways. There are many other forms of how this virus quickly spreads from one human to the other. But what is important for now is we need to identify the cases early. We need to isolate them early. We need to contact trace them very quickly to who they have met, who they have physical contacts with, or sexually transmitted contacts with, in order for us to get the contacts early. We have the vaccine. The smallpox vaccine was always around. It has shown 83% effective to the current variant of monkeypox. All the cases of monkeypox have not been severe. They've been milder. However, there's 5% fatality for this. Again, for comorbid and people with old age will be highly prone and vulnerable for now. And so this is an outbreak. This is not a pandemic. And outbreaks can be contained. And I think the whole global world will be hoping for this. Irrespective, the virus has a different surprise for us, like COVID had. But for now, we do not see any panic mode. What we need is a vigilant system in our public health, contact tracing to appeal to the public to know the symptoms of monkeypox and report very quickly. Because early isolation will save many more lives and the spread of the virus.
Professor, thank you kindly for your time this afternoon. CEO of Higher Health, Professor Ramneek Ahluwalia.